So, based on your blood test result, unfortunately, you actually have diabetes.
Doctor, what can I do to help myself?
Okay, don't worry. I will prescribe you Metformin. Metformin is... So, basically, yeah, Metformin is this. So, did you understand?
Ya, boleh, Doctor.
Okay.
Kita
Hi,
We are from Group 4 and we will present
diabetes and Metformin.
Hello everyone, welcome back to another video. This is Group 4 and today we will be discussing about diabetes and metformin. Now, discussing with you today are our group members Christina, Alia, Shazwan, Zulhazman, and me, Wajidi. Now, today's table of contents, we will be talking about what is diabetes mellitus type 2, how was it discovered, what is the biochemical pathway involved, what was the first drug being discovered, what is the mechanism of action of metformin, and what is the common side effect and counseling points. Let's get onto the video. Now we are going to be in depth about what the disease really is. This condition calls for a reduced insulin output. This means that the body cannot facilitate the entry of glucose into the cells to provide energy. In short, this means that there is a resistance to its insulin. Because we are talking about a condition where insulin resistance affects glucose uptake, we are talking about type 2 diabetes mellitus. Now, we are going to talk about how type 2 diabetes mellitus was first discovered. Now, we have no real idea when type 2 diabetes mellitus was actually discovered. However, we have some collection of first known descriptions about this disease in ancient times. One of the first known examples of these recollections were the Egyptian manuscripts. One of these Egyptian manuscripts describes a condition which calls for too great emptying of urine. Nowadays, we do know that one of the symptoms of diabetes is excess urination, which means that the Egyptians knew more or less of how diabetes affected the system. Moving on to another great example, we have the Indian physician Sushruta. He talked about a condition called madhumeha, which means honey urine or sweet urine. Now, we know that diabetes has been known for about a millennium. However, the first account was actually accredited to this person right here, which is Aretius of Cappadocia. He describes dramatically a no essential part of the drink is absorbed by the body while great masses of the flesh are liquefied into urine, which also talks about the excess urination symptoms of diabetes. And so, thanks to Aretius of Cappadocia and modern day applications, we have now known what the condition is in depth. And thus, it talks about type 2 diabetes mellitus.
Let's look how biochemical pathway abnormality can cause diabetes. For type 1 diabetes, it is caused by autoimmune destruction of pancreatic beta cells. These cells are responsible for producing insulin. When they are destroyed, the body can no longer make insulin, leading to complete lack of insulin signaling. For type 2 diabetes, the main issues are insulin resistance and beta cell dysfunction. The body cells become less responsive to insulin. Over time, these beta cells also lose their ability to produce enough insulin, and the result, impaired insulin signaling and also chronic hyperglycemia. Whether from a lack of insulin in type 1 or resistance and dysfunction in type 2, the end result will stay the same, which is no effective insulin signaling. And this makes the cells cannot uptake glucose and also at the same time increase gluconeogenesis and also glycogenolysis. Now let's look at how diabetes worsening can happen. So it can happen due to lipolysis and proteolysis. So for the lipolysis, Excess lipolysis release free fatty acids into the bloodstream. This will cause the free fatty acid to accumulate in pancreatic beta cells, causing ceramide buildup and also amyloid deposition. Free fatty acid can also be converted into ketone bodies, and this excess of ketone bodies can cause ketoacidosis. For proteolysis causes muscle breakdown and release excess amino acids. These excess amino acids can fueling gluconeogenesis and worsening the diabetes due to beta cell exhaustion.
Have you wondered what was the first drug being discovered to treat diabetes? The answer is insulin. And you may wonder who's discovered insulin. This guy, the professor who discovered insulin. His name is Frederick Banting, and this is his assistant Charles Bess. These are day back in the 90s. Continue on insulin. It was discovered in 1921. Banting and Bess introduced an extract of pancreatic islet cells from a healthy dog into dog with diabetes. By doing this reverse diabetes, they marked the discovery of the hormone insulin. Fun fact, the first person to ever receive insulin injection was Leonard Thompson on 1922.
Next, one of the drugs discovered to treat diabetes is metformin. So, who discovered metformin? So, actually, it was first chemically synthesized by both Emil Werner and James Bell in 1922. And then, clinical trials of metformin for diabetes was done in 1950s by this fine gentleman over here, which is called Gene Stern. So, to summarize, it was first chemically synthesized in 1922 by the Dublin chemists Emil Werner and James Bell. Then it was rediscovered in the search for anti-malarial agents in the 1940s. So, during the chemical test, it proved useful to treat influenza because it sometimes lowered blood glucose, and this property of lowering blood glucose was pursued by the French physician Jean Stern, who first reported the use of metformin to treat diabetes in 1957.
Moving on to the mechanism action of metformin. The first one is metformin act on the liver and activate the enzyme called adenosine monophosphate activated protein kinase known as AMPK, and it will inhibit the gluconeogenesis process, and lastly it will lead to decrease in glucose production. There are other mechanisms of metformin. So the first is it will increase insulin sensitivity. Second one is increase fatty acid oxidation. Lastly, it will decrease intestinal glucose absorption.
Thus, the metabolic pathway affected are metabolic pathway in the intestine, liver, and liver muscle. So, in the liver, the pathway affected are gluconeogenesis, glycogenolysis, and fatty acid oxidation, in which all are reduced, while in the intestine, anaerobic glucose metabolism is increased. In the skeletal muscle, insulin-mediated glucose uptake and glycogenesis are increased, while fatty acid oxidation is
Okay,
reduced.
so next we will look at the common side effect of taking metformin. Okay, so let's start. One of the most reported side effects is gastrointestinal discomfort, which includes the nausea, vomiting, diarrhea, and also the stomach ache. These symptoms usually happen when the body is still adjusting to the medication. Some people also report a metallic taste in the mouth, which might not be dangerous, but it can be unpleasant. Another thing to watch out is loss of appetite, which can affect the overall nutrient, especially in patients with diabetes who need to maintain a balanced diet. Okay, now, in long-term use, metformin may lead to vitamin B12 deficiency, which can eventually cause the anemia, which is why the regular monitoring is important. Okay, so lastly, although the metformin alone typically doesn't cause the low blood sugar, Hypoglycemia can happen if it's taken along with other diabetes medicine like insulin or glycoside, or even during fasting or intense exercise. So it is important to take it as prescribed and not skipping any meals. Okay, moving on to the next slide, we have to talk about something that is more serious. Although it is rare, it is very important to know. So the first one is lactic acidosis, which is a condition where metformin builds up in the body, especially if someone has the kidney problems, liver problems, or conditions like heart failure. The diagram here shows how it happens. When the body doesn't get enough oxygen, lactate will accumulate and leading to these dangerous conditions. Other symptoms to watch out for include fast or shallow breathing, feeling unusually cold or weak, slow heart rate, and very importantly, if the eyes or skin turns yellow, it might be a sign of liver issue. Okay, so if any of these signs appear, it is very crucial to call a doctor immediately. Even though this side effect is very rare, being aware of it can save lives. Okay, next slide, we will look at the counseling points. Next. Okay, so what to counsel the patients? As the pharmacist, first, we will always remind the patient to take their medications on schedule, preferably with foods, and never stop the medications without informing their doctor. Stopping abruptly can lead to serious health risk. Okay, so next, encourage patients to have regular meals, especially breakfast. Skipping meals can mess with their metabolism and blood sugar levels. The third point is, especially those on the diabetes medications, they should monitor their blood glucose level regularly, and they should always carry a fast-acting carbohydrate like sugar cube, fruit juice, or a sweet in case of a sudden hypoglycemia. Next, some medication may cause side effects like diarrhea if started at full strength, so the patient may start with low dosage and increase it slowly. The next point, when it comes to exercise, if a patient plans to work out more than usual, they should eat a carbohydrate-rich snack like bread, either during or after exercise, to prevent their blood sugar from crashing. Okay, the next point is, don't forget about the vitamin B12 monitoring, especially for patients on long-term metformin or similar medication. If their B12 level are low, supplements might be necessary to prevent the deficiency symptoms like fatigue or nerve problems. Lastly, these are the references we used. I think that's all from us. Thank you.